99.7 FM.
All right, when you hear that, Together Again by Dave Cause. Then your Sunday's complete and I'm in the seat. The name is Nortey by nature. The program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, 2:05. We are indeed alive. Ghana month on Joy 99.7 FM.
Joy 99.7 FM.
It allows me to go back and dig, into my old cassette case. Let's get something authentic. Let's see what I can find in there. Remember this one? I think it was 1985, right? When George Daku, Rex James and Co. were bringing in the Bugger High Life, straight from the heart.
Joy 99.7 FM.
DJs like the mixes, Yeah, I'm old school. When I say 1985, I mean 1985. But let's swing with it all the same.
Joy 99.7 FM. Joy 99.7 FM.
Okay, Tutuhini. My brother Tony Micah. I salute you up on the mountain, right?
Joy 99.7 FM.
Yeah, we can go on and on and on, right? Are we, Tell a friend to tell a friend. We're still doing the healthy stuff. This and every Sunday, 2:05, we're alive. Today, I have my eyes on the eye doctors. They will dodge me, and then we will make eye contact.
Joy 99.7 FM.
So I've got my eyes on Dr. Jifa Bella. I almost said Opheria time. Opheria J. I think she's a consultant pediatric ophthalmologist. Next to her, I have my eyes on another one. She's wearing glasses like me. Dr. Vera Bayo, and also a pediatric oncologist, ophthalmologist. Yeah, we're doing the Glaucoma Awareness Week, mobilizing and uniting everybody towards a glaucoma-free world. So we'll be learning what glaucoma is, and of course, their society, of which Jifa is the president. So I'm under her today. I believe, Vera, you're a treasurer? Or no, secretary? Pardon?
The CPD coordinator.
All right, continuous professional development, bro. All right, so let's get serious. Sit in the upright position. Yeah. Okay, so just bend the microphones a bit closer to you, yeah, so we can hear you. We can see you. We're live on Facebook and YouTube, Ultimate Health on Joy 99.7 FM. Now, my understanding from this side of the mic is that glaucoma is a progressive eye disease. It affects the optic nerve, but I'll stop right there. It's like my, Form 3 French. It stops at a point. But Jifa, you're welcome.
Thank you very much, Nortey.
Presidento.
We are excited to be here today.
I'm also excited. And when I'm late, the way I zoom to get here, so I didn't want to be late. But it's great to have you ladies back in the studio. It's been a while.
It has.
More than a year.
Yes.
Yeah. Last year you swerved.
We are not swerving anymore. We're done swerving.
Uh-huh.
We want to say a good afternoon to your listeners as well.
We've got
and thank you for the opportunity.
Eyes and ears on you. Glaucoma Awareness Week. Right. Let's talk a bit about your umbrella organization.
Yes. So the Ophthalmological Society of Ghana,
right,
OSG for short, is a professional body of ophthalmologists in the country.
Right.
And our aim is to advocate and then to educate the public on eye health. And we are part of the eye health team.
Okay.
We also have the optometrists, we have the ophthalmic nurses and the opticians as part of the team.
Part of the team or part of the society as
part
well?
of the team, eye care team.
That's right.
Yes. But the ophthalmologist is a medical doctor who's completed medical school and has further specialized to learn about diseases of the eye and treats medically, surgically, and by other means all eye diseases. Yes, so that is basically what the Ophthalmological Society is about. Okay,
great to have you. Vera, it's been a while.
Yes, it has.
I bug you once in a while when I had to refer somebody. And they always come back with good, positive feedback.
Oh, that's wonderful.
Great to have you. But let me just swing to your specialty, pediatric ophthalmologist. What's that?
Okay, so a pediatric ophthalmologist, before I say anything, good afternoon to your listeners.
Right.
A pediatric ophthalmologist is, as Dr. Foreje mentioned, a general ophthalmologist who has further subspecialized to take care of diseases that affect the eye in children.
Okay.
So we handle medically and surgically all eye conditions that affect children.
Okay.
Yes.
Right. Okay, so folks, if you've just joined us 12 minutes past the hour of 2, we're going to get into business and understand, what we're doing, what glaucoma is, and all this, care of the eye and all that, but specific to glaucoma. Let me ask, Jifa, so how prevalent or how common is glaucoma, right? It's Ghana month. I was going to bug you ladies with local names for glaucoma, but I know my discerning listeners are powerful. And so I'm sure they'll send me WhatsApp with local names. But if you know them in your language, you can share. But what is glaucoma?
So glaucoma is a group of complex eye diseases that affects the optic nerve. Okay. And it results in progressive reduction in vision and ultimately blindness if left untreated.
Okay.
And is the leading cause of irreversible blindness globally.
Okay.
And about 78 million people globally are affected by glaucoma, out of which 7.7 are blind, have moderate to severe visual impairment due to glaucoma. And in Ghana, like you asked, we are the second highest on the glaucoma league table worldwide. We're the second country, we're the second, number 2, with the highest prevalence.
Of all the places we could win
glaucoma.
Accolades.
Yes.
Glaucoma, we are second.
We are second
Well,
globally. And in Africa, we're number 1. And we're next to Barbados. And
hang on. Ghana, when it comes to this eye disease, right, that affects the optic nerve, right, leading to progressive loss of vision and then maybe ultimately
blindness.
Yes. Yeah. It's more or most prevalent in Ghana across Africa across the globe.
We're number 2.
Why?
Next to Barbados. I'm
not even interested in Barbados. No.
But you see, it's believed that the slaves from Barbados actually originated from Ghana.
Okay.
So there's definitely something in the genetics of the disease that is affecting us.
Okay.
There's a study that was completed last year called the Eyes of Africa, looking at the genetics of glaucoma. Wow. It looked at 5 countries: Ghana, Nigeria, South Africa, Kenya, and Malawi. And we took blood samples from patients with glaucoma, and controls, people without glaucoma, to understand why the disease is prevalent here. And you know, as with lots of genetic studies, the results are not out yet, but it is something that we are looking into. And the reason why glaucoma is difficult, or we have to create so much awareness about glaucoma, is because you do not know the cause. We know the risk factors that makes one get glaucoma, but what exactly causes glaucoma, there are a lot of theories now, but bottom line is that the optic nerve gets damaged, and when the optic nerve gets damaged, it leads to blindness. So look at your optic nerve like a cable that connects, let's say, your TV to the power source, the TV being your eye, and then the power source being your brain, and the optic nerve is that cable. So you can have a fine TV, good power, but if the cable is defective, then you will not be able to see.
I almost said it's like cable TV. I was going to mention a provider when it looks like it's going to rain.
Yes,
it looks like it's going to rain.
I plead the fifth.
I'll mention that. Folks, if you've just joined us, it's 15 minutes past your hour 2 on a Sunday afternoon. The program is Ultimate Health, your ultimate guide to healthy living, with me, Nortey by nature. I'm laughing because I've got my eyes on the eye doctors. They're in the studio to discuss and educate us on glaucoma. An eye disease affects the optic nerve. Jifa was just explaining that. And then progressively, this leads to visual impairment and ultimately blindness. I'll get them to, this distinction between impairment, blindness. When we say you are blind, does it mean you don't see anything at all? What does it mean coming from the ophthalmologist? If you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook, YouTube, and X. It's Ghana man. Somebody said the Gans will somebody Hex, but it's X. Used to be Twitter. All right, 055 11 11 997. Shortly, I will activate the phone lines. But Jifa, you threw it in a bit early for my liking. The word irreversible.
Yes.
I didn't like it at all before.
Yes.
What are you telling us?
So we're saying that if you're blind from glaucoma, there's nothing that can be done about it.
If you are blind
from glaucoma, there's absolutely nothing that can be done about it.
All the school and the specialization you and Vera went to do.
That is why we're sitting here, because we don't want you to get to that level.
Okay.
Compared to cataract. Cataract is a leading cause of preventable blindness. Preventable blindness.
All right. Irreversible.
All right. Irreversible.
And you added blindness to that.
Yes.
But let me backpedal a bit. So let's say it's starting. And picky, but picky. So if you say visual impairment caused by glaucoma, is that also irreversible, Vera?
Yes, actually it is. Whatever damage occurs in the course of glaucoma is permanent, and that's why we always recommend that pick up the disease early to prevent further damage.
Okay.
In fact, in the course of, we haven't gotten to treatment yet, but usually in the course of counseling and treatment, we let our patients know that whatever damage you came with at the time the diagnosis was made, unfortunately, is done. It's permanent. So we are trying to prevent progression. Because like she mentioned, glaucoma is a progressive disease. Okay. And so all our treatments are geared towards halting or slowing down the progression as much as possible.
Right.
And, you know, you were asking about how glaucoma is referred to in our local languages. So the accounts call it hintanifrae.
Okay.
You know, because it's the blindness sneaks up on you.
Okay.
It doesn't show any signs or symptoms at the beginning, and you think everything is fine. You don't have pain for most of the types of glaucoma.
Okay.
There's no pain. You're fine. You can see clearly. Your central vision is normal. You are losing your peripheral vision. That's the vision from the side.
Okay.
But you can't tell, because most of the time we are looking straight ahead. If you want to look at something, you may turn your head to look at the side. Until it's very severe, it's progressed so much, where the damage is so severe, then you realize that you have lost, or there's something wrong with the eye. And in fact, it's been found that in rural Ghana, at the time of diagnosis, about a third of patients have already lost vision in both eyes, are blind actually in both eyes.
Wow.
And the story is not so different in the city.
You're
Sometimes
making my eyes water.
Patients come, they've already lost vision in one eye before the diagnosis is made. They only realize there's a problem when they notice that the vision in one eye is completely gone.
All right. 20 minutes past your 2 on Joy 99.7 FM. I'm speaking with ophthalmologist Dr. Vera Berio and Dr. Jifa Bella. It's a compound, funky name, but you got to get it right. Jifa Bella Ofreje. I'm tempted to say Ofreje. I don't know why today is happening, but Ofreje, right? And we're talking about glaucoma. We're in the Glaucoma Awareness Week, so we want to hit it hard, right? We rank globally number 2 as a country, continentally, Charlie, no size. This is serious, especially because you just heard my guest emphasizing, hitting on it, that the damage this thing causes is irreversible. All right. So if you start to have visual impairment or compromised vision on account of glaucoma, we can't get it back for you. We can prevent it getting worse. Earlier, Dr. Jifa referred to, some risk factors. So obviously, coming from where I come from is a risk factor.
Exactly.
Right? What are the others?
Yes. So it's not all gloomy, right? So that is why we're here, because when the disease,
you mean there's light at the end somewhere?
There is. Right. There is. Once we catch the disease early, then you can preserve your vision. Okay, like Vera said, it's because the disease is silent. It's asymptomatic.
Right.
I think we remember asymptomatic from COVID times.
Okay.
That there's nothing to show that you have the disease. So the risk factors are, like we said, black race.
Okay.
So the fact that you're black is a risk factor. Now,
increasing if I bleach.
Unfortunately,
in fact, your risk
actually increases.
Okay.
Yes, because when you bleach, usually most people use steroids.
I repent.
Yes, and steroid itself increases one of the modifiable risk factors that we'll come to.
Right.
Okay. So black, being black, increasing in age. So growing. Okay, so most countries or most parts of the world, they worry about glaucoma from the age of 40. But for the studies that we've done in Ghana, we have to start screening from 20 years because it starts right around that time. So increasing age is a risk factor. Then when you have a family history of glaucoma, so if a first degree relative, like your father, sibling, uncle has glaucoma, then you are at risk, 4 to 8 times at risk of having glaucoma. There are certain mild risk as well. So if you are far-sighted, you're myopic, okay, there's a little risk associated with that. Diabetes, there's a little risk associated with that. So also because of what happens to the optic nerve.
Right.
And then there's one that is the increased intraocular pressure. Increased intraocular pressure is the only modifiable risk factors. All the ones I've spoken about, you cannot do anything about that.
Calm down. when you say big words like intraocular
pressure.
Okay. The pressure there we know.
Yes.
From
it's
all
different
around.
from the blood pressure.
From DDEP to dead restriction, all is pressure. But when you relate it to the eye, just slow down for my listeners.
So intraocular pressure. So there's this fluid in the eye. That keeps the shape of the eyeball. And provides nutrients for the eyes as well. It's called the aqueous humor.
Right.
The eye produces it. And the rate at which the eye produces it is the same which it excretes it. So it's in equilibrium. So you don't have any issues. But in a few people, the rate of production may be increased than the rate of excretion, or there's overproduction.
So this is like blowing a balloon, right?
Yes.
If the eye is the balloon, right? When you're blowing air into the balloon, then the aqueous fluid is entering and then doing all the wonderful things it's supposed to do.
Yes.
But you're supposed to lose some of that air as well.
You are.
To maintain a certain pressure
exactly
within the eye.
Exactly.
Got it. Okay.
Now, if that pressure is not maintained and it goes up, then it compresses on this nerve we described. So it is that nerve compression that causes the nerve to die. So imagine this nerve, about 20 million of them, little axons, nerves.
Right.
Just say fibers that are going and all bump up into one cord. So every time the pressure goes up, it damages a few of them. So that is why it's progressive. So it doesn't happen suddenly. It happens over a long period of time. So if you want to manage the disease, the only risk factor that we can actually deal with is the intraocular pressure.
All right.
So we can reduce the rate at which it's produced, or we can increase its excretion.
Right.
Yes.
So to add to what Chifa said, so like she said, rightly said, that you have this fluid produced, and then it's supposed to be excreted or drained through this sieve-like structure. Okay. Now sometimes the sieve-like structure can get obstructed, either congenitally or as an individual grows.
There's a drainage
channel.
There's
a drainage channel.
Exactly.
Exactly. And which sometimes becomes defective. Why it gets defective in some cases we can't tell. In some cases we're able to tell why it gets defective. And depending on the type of glaucoma, this sieve-like structure also lies within a space. The space itself may be closed completely, which we refer to as closed angle glaucoma.
So this is like structural.
Right. Or the space is open and you have the sieve-like structure within the space, through which ideally the aqueous fluid should have flown and then into the general circulation. But then the pores within the sieve are closed or blocked. And we call that open angle glaucoma. So now once you have
these are types.
These are the types
based on what is causing escalation or increase in pressure.
Exactly.
Good.
So once there's defective drainage and you have an imbalance between production and excretion, then it means that you're going to have a build-up and the pressure within the eye goes up. The normal pressures within the eye are supposed to be between 10 and 21 millimeters of mercury. Anything above that is a risk factor for glaucoma.
Right. Now, let me ask this. So we're dealing with the pressure. We're dealing with fluid, right?
Yes.
Tell me this fluid is not what we shed as tears.
No, it's not.
No, so that if you cry plenty.
No, it's not.
No,
I'm just mucking around.
Yes.
So it's not. We're not talking tears.
No.
Here.
Yes.
This is inside the eye.
And it's necessary for the eye. It's a good fluid. It's just that
it's supposed to be there.
Yes.
At certain pressure in certain quantities.
Exactly.
Right. Okay. And if it is not in that equilibrium or balance, then we can have an elevation in the intraocular. So inside the eye
pressure. Yes.
Okay. And you people can measure the pressure using your gadgets, your equipment and all that.
Yes.
Okay. Now, is it possible to have glaucoma, though this is a big major pillar in causation? Is it possible to have glaucoma without
Yes.
Increased
Yes.
intraocular eye pressure.
Yes. So like I said, it was a risk factor.
It's a risk
isn't
factor.
It?
Okay.
And the only one that we can modify.
Okay.
And there are studies that were done that shows that in Ghana, the most prevalent type of glaucoma is the open angle one.
Okay.
So that is the one where it's not a structural problem.
Okay.
It's just that the fluid is increase. About 90% of the glaucoma that we see is open angle glaucoma. The other types Vera spoke about may have other symptoms.
Okay.
That is why our focus is on this insidious one,
Okay.
because that's the commonest type that we have
Okay.
over here. So the intraocular pressure is the modifiable risk factor.
That
So
is
like you
something
said,
we can do
something about.
Okay.
You can have people who have glaucoma, but the pressure is normal.
Right.
So normal tension glaucoma. So the intraocular pressure is a risk factor.
Okay.
Now, when you use steroids, okay, when we're talking about, so you're bleaching your skin, or you have a medical problem, you go
Right.
to the pharmacy, you buy an eye drop that contains steroids.
Okay.
It increases this intraocular pressure.
Okay.
Okay, and the more you use it, let's say and the steroids makes the eye very comfortable. So you keep buying it, and the pressure goes up, and then it causes progressive damage to the nerve.
For my
Okay.
listeners, again, tell me you're referring to, in this scenario, self-medication. Of course, there'll be
Self-medication.
legitimate medical reasons
Exactly.
why this may be prescribed.
Exactly.
But you're talking about people who are abusing these.
Abusing steroids.
Right.
Yes.
Okay.
Yes. So
Otherwise
that
they'll
is
start fighting their doctors.
yeah. Yeah, that's right. Yes. So abusing the steroids. So any doctor who puts you on steroids
Okay.
will check your pressure. We'll keep an eye on it because we know there's a potential for the pressure to go up in a
Okay.
certain percentage of the population,
Okay.
not in everyone.
All
So
right.
we check it. And then, so we give you frequent appointments when you are on steroids,
Okay.
just so that we can check your eye pressure.
Okay.
Yes.
29 minutes past the hour of 2 on Joy 99.7 FM Ghana month. Yes, we're talking about, what did you say the account name was again?
Hinta ni fraye.
Okay.
Hinta.
Jifakra, I'm
Yeah,
not
the
sure.
hint out.
I'm not sure if you are proper well or some original counterfeit, so I won't go there. But my listeners are lovely.
gosh.
Listeners drown me in the indigenous names. Okay,
The Gans call it Tiemo Shiwalamo.
I don't have a clue.
So
Tiemo
Tiemo
Shiwalamo.
Shiwalamo.
supposed to be hidden blindness.
Hidden blindness.
Oh, okay. Oh, Shlamo, not Shiwalamo. Shlamo.
Shlamo. Okay.
Okay. Blindness. Okay. Good. Vera, Charlie, you there for me.
Ah.
Listeners, if you just joined us, 30 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. Since it's Ghana month, I'll say Ultimate Ed. You know where we are. This is Accra, but you're most welcome. If you've just joined us, we're talking about glaucoma with the ophthalmologist. If you have any questions, concerns, WhatsApp is 055 11 11 997. Some of you have lined up already. We're live on Facebook, YouTube, and X. And let me announce the phone line 030-221-6541. 030-221-6541. Let me read a couple of things in my inbox. All the mice are dodging me. Okay, Ziggy, I think it's here. All right. Okay, so this one says naughty. I am naughty. What is the naughty part? Be very careful. I have learned that smoking weed, here we go,
Yeah.
cannabis, can
Yeah.
reduce the effects of glaucoma. Docs, please.
Yeah.
I'm taking my time because
Yes.
I know his relatives will start adding some. By the way, what is the difference between glaucoma and cataract? That came up earlier. A champion, thank you so much. I was going to ask the doctors earlier, chew on this one too as I read a few more.
Okay.
I've heard intraocular pressure. And I know a usual suspect when I'm doing this program is hypertension. But I didn't hear it come up when we're listing risk factors. So just hang on to that. Good afternoon, Nortey. Can it be attributed to the sun? Wait, hang on. Or the water we drink? Because I notice that anytime I work in hot temperature, I see properly. And sometimes I have itchy eyes. Should I be worried? Gabriel K. Danso in Dawenya. Right? So he's looking at the weather, water. I'll come back to my doctors. Please, my name is Elliot from Insawam. Oops, what happened? Right? I have been diagnosed of glaucoma for about 2 years now, and I have not had any treatment. I was introduced to one of those eye herbal medicines online. I just want to know if it's advisable to use it or seek proper, you yourself, your chosen words, proper medication. Sometimes the herbal and other practitioners feel I bash them, right? But we want to get things clear here. So let's deal with this one. He's been diagnosed, so I'm assuming he's gone to a facility, seen a professional with a relevant or requisite qualification and experience. But he says he hasn't had any treatment. Okay.
All right. So the first one was diabetes and glaucoma and cataract.
Okay.
So cataract is age related. So all of us, if we live long enough, will have cataract.
Okay.
It's like I say to my patients, if way you develop wrinkles on your face when you grow, so the eye when it ages. Well, I have started developing wrinkles already.
Have my sympathy.
Yeah, so that is how the eye ages. So you have this white thing in your eye. So cataract can be treated.
All right.
We surgically remove it and it's treated. So it's usually age related. That is cataract.
Right.
But glaucoma is not. It's different. It affects the optic nerve.
Okay.
And yes, cannabis is known to reduce the intraocular pressure, but the quantity of cannabis one has to consume to cause substantial reduction of intraocular pressure will keep you in a catatonic state the entire time.
Are you listening? All right. I teach states of consciousness. We do psychoactive substances and we do substance-induced states of consciousness, right? And many of you, because of this decriminalization, legalization, you see, cannabis is a big family. And even if you want to go into details, if it is not extracted and processed in a certain way, like Chifa just said, if you are going to buy the one you are buying where you shouldn't be buying it, and rolling and smoking, please, she's saying then you must be consuming mega amounts to even get a noticeable drop in intraocular pressure. All right. And the reason I'm belaboring this is because many of you think that by saying it is for my eyes or for health reasons, then it changes something. I think it's still possession and stuff are still criminalized or illegal. All right. Though we are working towards, medicinal use and production and so on and so forth. So be mindful. But the question was specific to reduction or management of one of the troublesome but manageable symptoms, risk factors, which is the pressure. Okay, we've dealt with that. The herbal medication, he's been introduced to something online tagged as herbal. We haven't seen it. He hasn't named it. But what's your general comment on this?
Yeah, so once you've been diagnosed somewhere, the diagnosis has been confirmed that you have glaucoma.
Okay.
It's not advisable to seek alternative medication, especially when you are not sure of the source and what is in the medications that you are being given. Now, we have well-tested and proven methods of treating glaucoma.
Right.
Now, for some patients, the challenge
don't bear in mind, though, that the alternative medicine practitioners, they have their own association and some structure. So your comments are within this umbrella, okay? If you know the person is qualified with different, but just that tag which says herbal or alternative is what we're talking about. Okay, great.
So for some patients, when the diagnosis is made and they are given treatment, especially when the counseling has not gone down too well to understand the disease and what you're trying to achieve during treatment, they feel that, I'm just coming to the eye clinic every time I'm given drops and I'm told to go back home. I don't know nothing is changing. My vision is the same.
You need to be educated,
on the disease, counseling,
and what the objectives of
the treatment.
In quotes, treatment, because Ghanaians equate treatment with cure.
Exactly.
Right.
Exactly.
Great stuff.
And once you can't tell them that, your vision is going to be better everything is going to be fine, then it's like you're not doing anything.
So they go elsewhere and seek where they tell them that it will be fine.
Exactly.
Right.
Yes. So I would advise our listener to please seek appropriate care.
Okay. So if you're being told and if you are clear, it's conclusive that it's glaucoma, and somebody is talking about reversing something, my doctors, my specialist here, and I don't just bring anybody here, right? They are telling you that no, it is not reversible. What we seek to do is to prevent the progression, the worsening of what you already have. Okay? So if somebody is giving you something and saying, hey, and you know some of the things, they put them on YouTube and things, and say, for a limited time, you can read this before they take it down.
The pharma companies take it down.
Before the pharma companies take it down and all. Please, we're talking serious scientific stuff. It is not reversible, all right? If somebody wants to come and challenge that scientific fact, well, that's another story, all right? Okay, let me just...
And then there was one about high temperatures and...
yes, water.
Vision and...
Water as well. He says when he drinks water, he sees properly.
Okay. I'm not sure why he sees. I don't know if there's a direct link.
We don't even know whether he's dehydrated or what.
Exactly. But the listener who spoke about itching and when he walks in the sun or something like that. Yes, it could just be dryness. Dry eyes.
Okay.
And that can give you intermittent blurred vision, transient blurred vision, itchy eyes, foreign body sensation.
And if it's itching, you're likely to put your fingers there.
Exactly.
And
rub it and give you
worsen it,
give you infections. But that could also be easily treated.
Okay, great stuff. 39 minutes past your hour 2 on Joy 99.7. Good afternoon, Nortey. You are too much this afternoon with your selections. Papa answer from Latte. Hey, but we're still getting the stuff done. Good afternoon. Welcome to my home. Oye Inafienya. I salute you during this Ghana month. I see Dede was typing. Dede in Maryland. Yesterday was your birthday, Dede. Happy birthday once again. I've read Oye. Oops. Ziggy, did I announce the phone lines? 0302-221-6541. Ultimate Health on Joy 99.7 FM. WhatsApp is 055-1111-997. Back to my screen. I was scrolling up, wasn't I? There they are. Oof, trouble. Okie dokie. This one says, thank you. What are you thanking me for? Okay, Elliot, who asked about the hairball. Okay.
Yes.
Right. Please make sure you know what you are applying to your eyes.
It's
important. They don't sell them at Kokompe. I beg you. Or Aboso
You cannot get a spare eye.
You can't get a spare eye. All right. Good. Good afternoon. My sister's daughter was diagnosed with glaucoma 2 years ago. She was 13 then. She's now 15. She did her glaucoma surgery last month. But now she's having difficulty opening her eyeball to the full degree, right? So opening her eyes, not the eyeball itself. Please, any advice, Doc?
Yeah, so we'll talk about the treatment of glaucoma. And the first step, like Vera said, is counseling. You need to understand that this treatment is not going to cure the disease. We're going to manage the disease. Whatever visual impairment or visual deficit you have at the time of diagnosis will be there. The aim of treatment is to prevent you from going blind. Now, there are 3 main ways that we treat glaucoma.
Let me just pause you and do justice to this, and then we can go into treatment and management and all that. I'm concerned about the contradiction between 2 eye doctors. One suspected glaucoma due to my eye. Due to my eye pressure and prescribed eye drops, while another said my pressure was fine and I didn't have to be put on the medication and took me off the medication. Should I be worried? Okay, this is from Eddie. I don't know the doctors. I don't know the facility. Right? What do you have to say to that?
It happens. Glaucoma can be a very, Dr. Frey just mentioned earlier, it's a complex disease. And it can be very confusing to diagnose at the beginning. And there are lots of things in the eye that can look like glaucoma but are not glaucoma. Because once the tag of glaucoma is put on a patient, it has implications treatment-wise. because it's a lifelong disease. And so we always want to be certain that we are actually dealing with glaucoma before we commence
Should
treatment.
you be seeing a specialist?
Yes, you should, bopefore the diagnosis is confirmed and treatment
It
started.
must be confirmed by a specialist.
By an eye specialist.
Okay.
An ophthalmologist.
Yeah.
All right.
Yeah. So what was actually happening too is that it could be that at the time he saw the doctor, his pressures were high, and the medication brought the pressures down.
Okay.
So with this second visit to your new doctor, you may have normal pressures, but it may be due to the medication you are on.
All right.
Okay. So once the doctor stops the medication, he will ask you to come back. If you come back, the pressures will definitely creep up again. Right. And then at that point, you would notice that it's the medication that has been working all this while.
Okay. Would I be right in suspecting perhaps that the requisite counseling didn't go deep enough?
It's possible.
So they are misconstruing the objectives of treatment.
Yes.
And therefore, if they hear something else, then the two doctors, they're not correct.
Yeah, it's possible.
All
so
right.
I would recommend follow-up.
Okay.
They should follow up.
Please follow up. Good afternoon. My mom has glaucoma and she's blind at the moment. Oh, so sorry. Do I stand a chance of inheriting it? What should I do? I change my spectacles every 2 years by visiting the eye clinic. This is from Queen.
Okay.
Yes, Queen, you do have you have a risk of developing glaucoma, and so at each visit, if you are 30 years and above, we recommend that you have a yearly comprehensive eye exam.
Okay.
Now, when we talk about comprehensive eye exam, your intraocular pressures should be checked. And remember, we said the normal pressures are 10 to 21. And then there should be an eye care professional who examines the optic nerve to see whether there are any changes that are suggestive of glaucoma.
Okay.
Sometimes people say, oh, I go to the eye clinic to change my glasses. But sometimes it's just a refraction that is done, or a visual acuity that is done. You may have advanced glaucoma and still have 6/6 vision.
Okay.
And so it's not just about the visual acuity, but your optic nerve needs to be examined by an ophthalmologist.
So if it was for corrective lenses, I can go do the test, the
anywhere.
wicked ones that they keep reducing the size and I'm struggling, right? What you're saying is that I can score on that one.
6/6.
But I may still have
glaucoma.
Advanced glaucoma.
Yeah. Okay, so it has really is not related to
no,
those tests.
It's not.
Okay,
it's not.
Okay, that's optometry, and then we are measuring. Visual acuity.
Exactly.
Okay.
So some optometrists will go ahead and check for glaucoma, but routinely, when you're changing your glasses, glaucoma test is not usually done.
Good
now, when you're checking your optic nerve, one of the things they'll do is they'll put some drops into your eye and ask you to wait a bit, because the hole in your eye, the pupil, we're trying to dilate it, so we can assess the optic nerve well.
Okay.
So typically, you have some drops instilled in your eye, wait for 10-15 minutes, come back, and then let's take a look at the back of your eye.
Okay.
And like Vera said earlier, glaucoma starts from your side vision, your peripheral vision.
Okay.
So your central vision is going to be normal. Okay. So it is the peripheral vision that will be affected.
Okay.
And when you are changing your glasses, you use your central vision. So it's likely that it won't be picked up. Now, let me tell you this story that has stayed with me for many years. There's a 10-year-old boy I saw in the clinic. His father came with him because he noticed the boy couldn't see in one eye.
Okay.
They went to a children's game park or something where they shoot paintballs.
Okay.
Right? And when he was aiming at the paintball and he closed one eye, he noticed that he couldn't see in that eye. And the boy was 10 years old.
Okay.
He does well in school, no problem, because his other eye has got good vision. So he has been moving around with his one eye for many years, and did not notice that there was glaucoma in there.
Compensated.
Yes, it's compensated
for the impairment of the other eye.
You remember Vera told you that there was a study that we did that shows that a third of the patients who came to the hospital were already blind in one eye from glaucoma. So this boy, had he not gone to this shooting, and imagine, shooting range means that it's an educated family, a certain level of income for you to go.
So he closed one eye.
Just closed one eye, noticed that he couldn't to shoot, and noticed he couldn't see. So that is how insidious glaucoma is. So your optic nerve has to be examined. Especially when you are above the age of 30 years in Ghana.
And especially by a specialist.
Yes, especially by a specialist.
All right, you're on Joy 99.7 FM. Program is Ultimate Health, your ultimate guide to to healthy living. I'm talking glaucoma, and yes, I'm blinding myself. Phone line 030-221-6541. WhatsApp is 055-1111-997. Dede birthday girl in Maryland says, could bulging eyes due to thyroid disease lead to glaucoma?
No. So in it, bulging eyes in itself will not lead to glaucoma. Bulging eyes is due to thyroid eye disease. However, there are some muscles in the eye that also swell up in the process of the eyes bulging, and that can cause increase in your intraocular pressure. It's not the bulging eyes in itself, it's the disease process that may cause the pressures to go up.
Good day, Nortey and guest, and thanks for your insightful discussion this afternoon. Kindly ask your guests, what are the signs and causes, and is it hereditary? Sarah, you came to class late. Stand on your chair, all right? But my doctors will do you the honors after I read a couple more, okay? So she wants to know, again, is it hereditary, signs, symptoms, and then causes? We talked about that earlier. This one says, Nortey, Ebium. Oh, this is the weed. Is it related to the inability to see from afar?
So the inability to see from afar is a risk factor. Okay, but it is not in itself. So it's a risk factor for glaucoma.
Okay.
All
right. Good afternoon, Uncle Nortey. Good afternoon. Scroll. Please, what's the difference between short-sightedness and glaucoma? Another Dede.
Okay. So short-sightedness or myopia simply means that the individual is able to see objects that are close to them. But if you have a target or an object at a distance, then it's difficult for them to see. Now, short-sightedness is not the same as glaucoma. Glaucoma, we've already explained, is a disease that affects the optic nerve. Now, short-sightedness has been found to be a risk factor for glaucoma. So if you are short-sighted, it just means that you have to be going for regular comprehensive eye exams to check for glaucoma.
How regular is regular, Vera?
So the recommendation worldwide is that the screening should be done above age 40 years. But because of the high burden in our country, our recommendation is that the screening should start. In fact, this is based on a study that was done. From 20 years, you should have screening every 2 years, a comprehensive eye exam every 2 years.
Even if you're fine?
Even if you're fine. Even if you're fine. After age 30, should be yearly, and then same for and beyond.
Are you enough? Me, I have 2 eyes. Everybody else has 2.
Yes.
And you're saying we should screen every 2 years?
Every 2 years.
Are you
but not we spoke about the eye care team
the
when
eye
we
care
came
team.
here.
So we have in some facilities you have an ophthalmologist. If you go to a facility, an eye center that doesn't have an ophthalmologist, there may be an optometrist or an ophthalmic nurse. Now, these 3 cadres of eye health professionals can check intraocular pressures, can examine correctly the optic nerve. And for the optometrists and ophthalmic nurses, once they pick up the signs suggestive of glaucoma, usually they would refer, depending on the availability of an ophthalmologist nearby. So wherever you are in the country, you should be able to have a comprehensive eye exam done.
Phone line still active, 030-221-6541. WhatsApp 055-1111-997. We're talking glaucoma. We are getting into a bit more a recap on the signs, symptoms when they do show, and a few of the hereditary issues, and then we'll wrap up on some of the interventions, or management, right? Because when we say treatment, then people start getting all sorts of funny ideas. Good afternoon, Lady Akofa. Really? Akofa? Is this for me? No, I think This is for Akofa with the sweet voice who comes in the afternoons. Never met her, but I hear her voice. Okay, good afternoon, Nortey. My son is 14 and asthmatic. He sometimes complains of itchy eyes. Is there a possibility of him getting glaucoma in the near future? Thanks, sir. This is from Echoes in Ebri.
Okay. So for the same factors that result in asthma can also result in allergic eye disease, and that will give the itchy eyes.
Okay.
That is not directly related to glaucoma.
Okay.
Well, we talked about steroids and glaucoma, and that if he's on steroids for a very long period, then there is a small risk, and so I would recommend that she sees an eye care specialist just to check his pressures, and then that itchy eyes can also be treated.
Okay. Right. Somebody says, please ask the doctors, how are we streamlining the optician that are treating patients with glaucoma without referring to the specialist? This is from Doris. So are there people claiming to offer treatment without the requisite qualifications? That's what she's asking. Is there any way you can check if people are doing hanky-panky out there?
Yes, so that has always been the issue. For glaucoma, we would say that you need to see an ophthalmologist. Okay. You need to see an ophthalmologist for assessments to be done and confirm that it is glaucoma.
Should I ask my doctor, hey, are you an ophthalmologist?
No, actually you should. I've had patients ask me, are you an ophthalmologist or optometrist?
Right.
Because they want to be sure.
You see,
so you can
ask.
Are
not that assertive. You should ask, right? And you are entitled to a response.
Exactly.
Okay. So ask if you are actually seeing or being seen by an ophthalmologist. Okay.
So usually, if the ophthalmologist diagnoses you with glaucoma and you are in a region or you are in a place where there is no ophthalmologist, sometimes the optometrist or the ophthalmic nurses can monitor you, because like Vera said, they can check the eye pressures.
Okay.
But periodically, you should be sent back to the ophthalmologist to know whether the disease is progressing or not. Okay. You know, we were going to speak about the management. That is where the management comes in. You know, because glaucoma is the treatment for glaucoma becomes expensive when you are advanced. Okay. So there are studies that have shown that the treatment actually quadruples when the disease is in its advanced stage.
Potentially, you are going blind.
Potentially you're going blind. So it's important that you are assessed, and then when there's a decision to change the treatment is changed. So we have medical treatment or medical management. Then we have surgical management. Surgical management, Vera described the sieve through which the fluid passes through, and said that sometimes there can be a blockage. So with the surgery, you create a diversion for the fluid to pass through, and the pressures are down all the time. So that is the difference with surgery.
So you're working like a vulcanizer and a plumber all in one.
Yes.
Exactly.
All right.
Yes.
To reduce the pressure.
And
then make sure the flow or the channel for the flow of the fluid.
It's relieved.
Right.
So the pressure comes down.
Great.
Okay. Now, surgery is best done early in the disease. When you don't have any symptoms. Most people will say that when I do say, some people say they did surgery and then they became blind. Most Ghanaians would wait till the disease is advanced. And if surgery wasn't done, the likelihood that you would have gone blind is there anyway. So it's important to opt for surgery early on in the disease. So there's surgery for glaucoma where the pressure is down all the time. Now you have medical treatment.
Hang on, please. So surgery is also to arrest the progression.
Exactly.
Surgery is not going to miraculously
restore the vision. No, it's not restore the vision.
That's why I stopped you. Right.
Yes.
So somebody thinks that you are going for this surgery and you are looking at Jifa and then she does her thing and still
you can't see well.
So surgery is still to arrest, to stop the progressive damage to your eye. and the progressive loss of vision.
Yes,
exactly.
Yes,
Okay.
exactly.
Good.
So surgery is to halt progression,
Great.
not
Understood.
to restore lost
You
vision.
are not doing miracles.
Yes.
Okay.
Okay.
Good.
Now, with the eye drops, then the other option is the installation of eye drops. These eye drops must be installed regularly and according to the way you are taught to do it.
Okay.
Okay. These eye drops bring down
My
your
dear
pressure.
Jifa, can you clarify for my listeners? Sorry, I'm be a bit picky on these things. That eye drops are medicines.
Yes.
You know, people use them and they think, oh, the thing is still feeling this way or that, so they add more. So you'll be given a regimen to follow.
Yes.
When to administer.
The eye drops.
So
And
it is medicine.
It's medicine.
Okay, great stuff.
And must be done consistently.
Okay.
Now, the issue with the eye drops for glaucoma is that they are very expensive. The cheapest or one of the drugs that is used commonly may cost as much as 200 Ghana cedis.
Okay.
Now, we're saying glaucoma affects people who are above 40 years of age. Imagine that you have other competing interests with your funds.
Okay.
So you probably have hypertension, have diabetes.
Which funds don't have competing interests?
So it becomes difficult
Right.
to afford the medication. So some people use it as and when. Maybe they are coming to the hospital, then they instill the drops. But when they are home, they do not.
Okay.
So just a week before coming, they buy the medication and then instill.
Right.
So that is not consistently using your medication.
Okay.
Now, if you're traveling out of town and you're on medication, you need to carry the medication with you, because whilst you are there, intraocular pressure will still go up. It's not aware that location has changed.
Right.
So it may go up, and when it goes up, it will cause damage to the optic nerve. And this damage, we said, is progressive. So if you have 20 million and every weekend you are away from Accra or you are out and not using your medication, you are damaging the nerves little by little.
Okay, we're running out of time, but let me ask. So is medication always in the form of drops, eye drops? Always.
Yes, always in the form.
We
We
have
have some oral
orals.
medications
Okay,
too.
right.
That usually you'll be given to use temporarily. Okay, because they have a lot of side effects. So when your pressure is really high, then these oral medications the aim is to crush them quickly.
Okay.
And then just to chip in about the medication inconsistency of using medications, it's been found that fluctuations in the intraocular pressure worsens or hastens progression.
So you take your medication sometimes, you don't take it.
You are actually worse
making
off,
it worse.
compared to someone who hasn't started at all.
Right. Okay. So have we covered all the
And then the last one is laser.
Laser.
Yeah. So we are able to shoot laser into the eyes.
Okay.
I keep telling my medical students, ophthalmology is the only subject that we shoot lasers into things, like Star Wars. So it's a very cool specialty.
Funky, cool doctors. Eh?
So we create this opening in the eye with the laser.
All right.
Then the fluid goes through it. Usually the lasers will have to be repeated over a period of time because these holes can seal off. So the management is medical, surgical, and then lasers.
Okay. Great stuff, right? We've got a lot of things to read. My producer has drawn my attention to that. But let's be clear, when we're talking about laser and all these things, laser can be used for other things. We are talking about glaucoma.
Glaucoma eye
Don't
laser
go to
surgery.
any laser place for something else and say, this is that. I know my listeners. I know the Stubborn Academy, right? I used to be their president, but I resigned, right? Okay, but yes, you could be going somewhere for something else.
A
not
different
glaucoma.
type of laser.
You listen to this program and then you start making all sorts of arguments, okay? So my doctors are speaking specifically to glaucoma, right? I will definitely have to have them back because, wow, we've got so much to read. And it's 3 o'clock already. Ziggy, are you scrolling on my behalf? The screen is dancing. Leave my screen alone. I have my eyes on you. Hayford in Bator says, Nortey, how are you and your guests? Well, they look fine. I'm fine. So, yeah, we are good. Please, it's a long time I had this educative program just because I lost my father and going for meetings that not permit me to have time to listen. My condolences, Hayford. But today I'm with my radio. I would like to know if the nerve in the system affected, can't another one develop to replace the nerve? Is there a spare optic nerve?
No.
Who knows? In the future, they probably may be able to regenerate. But for now,
nope.
We have only one.
Okay, and you have one for each eye.
One for each eye.
Okay,
which you must guard jealously.
All right. Good afternoon. My mom has glaucoma and she's blind at the moment. Do I stand? Okay, we read that one.
Yeah, we've read this one.
Okay, Queen, send that. Hey, Queen, I hope you went to do the cervical cancer stuff. You wanted to do the full Monty, the full range, and I hope you got that done. I'll give you a shout and see. Thank you, Nortey. I'm 54, short-sighted, and I've been wearing spectacles for the last 25 years. Kindly recommend a specialist. Queen again. All right. I need to meet Queen. So she's short-sighted. She wears spectacles. She's been wearing them for 25 years. She wants an eye specialist. Okay. Normally we don't do that on my show, but I do have your contact from last week's because of the cervical stuff. So we'll see if we can, should I say, assist, facilitate. All right. Quickly. Ziggy, am I clear? Nope. There's a green there. There you are. Good afternoon, Nortey. I hope you're doing well. I'm reaching out because I'm experiencing some eye issues. I've noticed a growth on my eye, which is causing persistent dryness and redness. I visited the eye clinic, and after a series of tests, I was given eye drops. However, the redness hasn't subsided. I'm worried it might be something more serious like glaucoma. Could you offer some advice or guidance on what I should do next? Greatly appreciate your input.
So usually a growth on the eye with these other symptoms is caused by, the commonest cause is what we call a pterygium, quite common in our environment.
Okay.
It's not the same as glaucoma. So I'll recommend that if the symptoms are not getting better, he should go back to see the eye specialist, or request for a referral if he's not seeing any improvements. Pterygia usually can be removed surgically, and that usually helps with the symptoms. And then at the same time have screening for glaucoma. Okay,
right, great stuff. If already not done, could they explain, this is Dede, Maryland, the difference between optician, optometrist, and ophthalmologist? Most people think they are one and the same. They are all, she says the eye doctor. This is Dede, my friend. Yesterday was her birthday. And for a reason, she doesn't come to Ghana as often as she used to. But can we quickly split these?
Yeah. All right. So like I said earlier on, and thanks Dede for the question. Happy birthday. So ophthalmologist is a medical doctor. So completed medical school, specialized in eye, and does medical and surgical treatment for the eye. Now, optometrists are doctors of optometry. They are not medical doctors. They treat diseases that have got to do with refractive errors and then ocular motility. So typically when you go to change your glasses, it is the optometrist that will see you. The optometrist can also treat certain minor diseases, eye diseases. Now your optician is the one that actually cuts the glasses after the optometrist has done the test and has seen what the error is. So we'll take you to the optician, and then the optician will carve the glasses for you. And then in our setting we have ophthalmic nurses. These are general nurses that have also subspecialized in eye. So the ophthalmic nurses usually, most of the time, work together with the ophthalmologist. They assist us in theater, they are with us in the clinics, and they also are able to manage certain minor eye diseases. Yes.
Great stuff. It's been great, and let me call it an eye-opening experience having Vera and Jifa. We'll reconsider whether we might bring them in next week to should I say wrap up on some of these things. We've gone almost 6 minutes past the time. Hi Nortey, my eyes sometimes itch and it feels like pepper has been sprinkled in them. I visited an eye clinic. Could this be a factor? Could glaucoma be a factor, itching?
Unlikely. Most likely due to dry eyes or allergic eye disease.
Right. Good afternoon, Nortey. Please take your time to enumerate the signs and flags of, who is this? Abraham in Damfa. Abraham, we did that way.
Yeah. So glaucoma is asymptomatic, no symptoms at all. So you need to get to the eye clinic so that the eyes are checked for glaucoma.
Abraham, I'll bring them next week, especially for you. Please note it by nature. Can headache be a contributing factor? Because sometimes you have severe headache and you feel pain in the eyes.
Not
likely. And then
however,
you see,
there's a minor type of glaucoma, less common. the angle closure, where you may have severe eye pain, redness, one-sided headache. Okay, and for that type of glaucoma, it's headache on the side of the head could be.
If in doubt, have it checked.
You need to have it checked.
Bring the doctors again, please. A student of mine used a weedicide to spray the family farm. Please, I think the concentration of the weedicide is too high. Please, kindly, the student has a challenge in the eye. Hey. Right.
Yes, so there could be chemical injury to the eyes.
Yes. Papani, okay.
Yes, so he should have it checked.
Have it checked, all right? Okie dokie, I've got to close the WhatsApp, whether you like it or no. Right? Surgery done outside. This one is, what is this? I want your expert advice on this. My mother had glaucoma and her vision was impaired. Later on, she had the fluid drained from her eyes, which improved her vision. The doctor said my siblings and I should have our eyes checked every 6 months. Isn't that too frequent? The surgery was done outside for him. Okay.
So usually depends on what you see. So that's when you examine the optic nerve. This 1 year, once a year, and every 2 years recommendation is what we usually will recommend routinely.
Okay.
However, when we look at the back of your eye, depending on what we see, we may even ask you to come in earlier, 3 months. Okay, for review.
Great stuff. The doctors, the eye doctors, I have to kick them out. My eyes are watering. Many thanks, Dr. Jifa Ofreje, Dr. Vera Beyo, ophthalmologists, opening our eyes, but definitely next week we'll probably bring them back. Still gone a month there. I'm trying to appease my producer Ziggy. A.B. Krensel. So you can stay on Joy 99.7 FM. My name is Nortey by nature. Yeah, I'm out of here.
What will be baby Asimwa? What's sorry for no one answer? Next Sunday night, you not go phone.